Episode of Paramedics. A young couple fight to save their 6-year-old daughter suffering from a shocking disease.
At this stage, there is no cure, and she has a 20% chance of being dead before she's 20.
I don't know how you cope.
You all right?
I've been better.
I've been better, old mate.
A retired cowboy gets back in the ring with disastrous results.
He can have a tension pneumothorax, which can make the heart stop beating and can lead to death.
Oh,
Sorry, mate.
Sorry, buddy.
63 years.
And Amanda and Taz get a lesson on how to make a marriage last.
What's the secret?
Oh, every now and again you got to clock around the ear a bit.
Emergency services. Tell me exactly what's happened.
I've got a 6-year-old daughter having a seizure.
Is she breathing?
Not very well, no.
At the State Emergency Communications Centre, the father of a 6-year-old epileptic sufferer is calling for help.
Has the twitching stopped yet?
No, it's getting worse.
Okay, I'm organising help for you now. Just stay on the line.
Single responder Glenys is now on her way to the little girl in trouble.
A 6-year-old continuous fitter. I believe the child is known to fit for long periods of time.
Although the girl is no stranger to seizures, this one has everyone alarmed.
12 minutes is a considerably long time for a 6-year-old to be fitting because the brain's been deprived of oxygen for that time. That can lead to some permanent brain damage if we don't stop it quickly. 1, 7.
The girl's parents know they must act quickly.
What is happening?
We know what to do. We're about to administer midazolam. Midazolam, 5 milligrams. Yes, just done that.
Midazolam is a powerful sedative that stops seizures, but can have dangerous side effects.
Is she still fitting?
Yeah, she's not breathing either.
She's not breathing?
Hello, love. Who am I here to see? Midazolam has complications and nothing surer than death and taxes. It'll drop her blood pressure, drop her conscious state and drop her breathing effort. So we need to be very aware of that in the young Harper. I'm Glenys. What's your name?
Aaron.
Aaron, and you
Kelly.
are? Kelly.
Glenys arrives just as the drug is starting to take effect.
Now she has these, does she?
Yeah.
The first thing I notice is that she's not fitting anymore, but she's still unconscious. She's on the floor and her mum's holding an oxygen mask on her face, so she's not out of the woods yet.
In your house, is there any area a ghost is not allowed to go?
It's a much less stressful start to the day for paramedic buddies Taz and Amanda. Taz is kicking it off with one of his trademark dad jokes.
In my house,
Or any house?
a ghost is not allowed to go.
Living room.
The living room. So good. You certainly brighten the day, Taz, that's for sure.
But the dad jokes are shelved as a call comes in from an elderly woman who urgently needs help.
All right, Taz, we've been dispatch code 2 to an 81-year-old female with redness and swelling of the ankle, which is tracking up the leg. Could be cellulitis. And if it is cellulitis and she's shaking, chances are she's got a bit of a widespread infection. So she could be septic.
Sepsis is a systemic overall infection. It's overwhelming to the body, it shuts down your organs, and it leads to death.
Are you there? Is that where we're going? Is it that one? Good evening. What's your name?
Neville.
Hey, Neville.
How you going, mate?
How are you, sir?
Good, thanks. Well,
Who are we here for?
my wife,
What's her name?
Marion.
Marion. What's happening with Marion?
She just... We went to the doctors and then we come back and then we start to roll and now she's rubbish.
Yeah, right, okay. Take a seat, darling. What's happening?
That. This afternoon I was sitting at home. I suddenly noticed it.
So all the redness is new?
Yes.
My gosh, she must be uncomfortable. It's red, it's swollen, it's hot to touch, and it goes the entirety of her shin.
Now, Marion, it looks like you have a bit of an infection that we call cellulitis.
Yes, I had that about 3 months ago.
You've had...
But not as bad as...
Not as bad as this, but it was the same, not as bad.
The more Amanda investigates Marion's symptoms, the more worried she is. Cellulitis is a bacterial infection in the skin which can result in life-threatening sepsis.
We've just taken your temperature and it's pretty high. So that would explain the shaking that you had a little bit earlier.
Her temperature is high. This is a sign that her body's trying to fight the infection. Her heart rate is also quite high.
Is your heart rate usually pretty high?
No, not really. I don't think so.
These are all signs that she's on the tipping edge of being septic.
Out on the road in Melbourne's east, intensive care paramedics Doddsy and Al are on an urgent mission. A man has been crushed by a swinging gate at a rodeo.
I'll give you details, guys. 68-year-old male has had a full force of gate in the chest and thrown a distance, having had the horse bolted literally.
Every cowboy in the Southern Hemisphere will be here today, mate.
Whip.
These long-time paramedics have been good mates for 20 years.
Hey, move.
Well, look at you go.
Well, clearly I've got these on, champ.
Al's a magnificent paramedic and he's someone that I have a world of respect for. You don't go to work anticipating to make friends, but I've been lucky to find a good one along the way now. He's a really good bloke.
But the mood changes as more details come in.
Sounds like the main impact. He had a LOC of between 3 and 4 minutes. His IC at the moment is confused as well.
If the patient was knocked out for several minutes, it could mean head trauma. But right now, the paramedics are more worried about what's happened to the man's chest.
If he's been hit with that...
swinging gate, we're talking big
and
gates.
then
Great blunt force.
you'd wonder whether or not, fractured sternum, flail segment, so we want to make sure we have a good look.
A big steel solid gate kicked by a very large animal. It must have been a pretty hard whack. So the concerns for us is, has he popped a lung?
As Doddsy and Al arrive, they have to find their way through a large crowd of spectators.
There's lots of cowboys. Yeah.
Rodeos remain popular throughout Australia, despite the high risk of injury, even death, to both cowboys and animals.
I don't particularly like horses, bulls, anything that are larger than me with 4 legs, no.
Are you happy to pull all this off and just put yours on?
Yeah. Al? So we'll just go straight in.
Yeah.
Have a look,
Yeah. Bring him closer, guys.
A local paramedic crew already has the patient on a stretcher.
How you going, old mate? You all right?
I've been better.
Have been better, old mate. Righto.
68-year-old George is the rodeo manager, but when they were short on staff, he made the fateful decision to help out in the arena. This is the moment he was hit by the full force of a swinging gate.
George's injuries could see him in a lot of trouble. If he's punctured his lung and he's got a build-up of air in his chest, he can have a thing called a tension pneumothorax, which initially can make the heart stop beating and can lead to death.
How severe is the pain at the moment?
I just had a tonic-clonic seizure for 12 minutes. Stopped breathing for a little bit.
Intensive care paramedic Glennis is trying to wake up 6-year-old epileptic Harper. The little girl has just suffered a dangerously long seizure.
She had midazolam.
How long did it take for that to work?
5 minutes.
Okay.
Parents Aaron and Kelly have given Harper the powerful sedative midazolam to stop the seizure, but she's now unconscious.
I might change her over and give her a little mask that she's a bit more comfortable with then. Yeah. Guys, can we put some O2 on? She has stopped fitting, but my immediate concerns is how well is she breathing and is she going to come out of that unconscious state quickly?
She's got Dravet syndrome.
Dravet. How did you find out about that? It was just multiple seizures?
She had her first seizure at 9 months and then it just got worse and worse and worse.
So Harper suffers from Dravet syndrome, which is a rare and catastrophic form of epilepsy. So usually about once a month she'll either be hospitalised or as bare minimum we'll have to call an ambulance.
And she's developmentally on track with school?
Yeah.
What year is she sitting in? Grade 1.
Hey, darling.
Oh,
Okay.
that's so...
It's just some fresh air, honey.
There you go. Good girl. Good girl.
Yeah, you feel well, honey.
At this stage there is no cure for Dravet, but then the added part to that diagnosis is that she has a 20% chance of being dead before she's 20. When you get handed that news, it was like our life completely stopped still.
Oh, darling, I know you don't like that, but that shows me a great level of awareness that you hate that thing on your arm. Good girl. Hello. Yeah, honey.
Harper is finally starting to wake up.
110 on 80.
Which is great.
Harper's got good breathing, getting good oxygenation to all her body. So I'm very happy that she's on the up.
What's your name, sweetheart?
I'm Frankie.
Oh, I love that name.
But this must be very distressing for the parents and for young Frankie, her little sister, seeing this on a regular basis.
He's 16 old.
Emotionally, children are always difficult. They do pull on your heartstrings. And I try and stop myself from drawing in and looking at poor little Harper on the floor, because you think, how could I cope if that was my own?
So, Marion, you've had cellulitis before?
Yes.
Yeah, okay.
Amanda and Taz are becoming increasingly concerned that 81-year-old Marion could be suffering a life-threatening infection from a severe case of cellulitis.
So my wife was all right till lunchtime, and then she went down fast, you know. So we thought, get some help. It's not good just sitting there, is it? You know, and just do nothing.
Yeah, Neville will have to come with me.
That's fine.
He can't drive.
That's fine.
So he's got.
Okay. We'll get you sorted.
Amanda and Taz want to get Marion straight to hospital, but she's far more worried about Neville being left at home alone.
I think one of the hardest things for any couple to endure is when one of them gets dementia. You know, that person's been your rock, they've been your support, and all of a sudden they're not capable of doing that anymore. Just tragic.
So you spend a lot of your days worrying about this gentleman?
Yes.
Means you don't have time to worry about your own things?
No.
Think about you.
I know.
How long have we been married for, guys?
63 on the 2nd of April.
63 years.
Yeah.
And how did we meet?
Well, in England, we used to walk the town and eye the boys up.
Walk the town and eye the boys up, eh? And he was the handsome one. Yeah?
Your friend who you were in the army with introduced me to you, and I was going out with him at the time.
Oh, you piffed him aside and now you've got young Neville.
Yes.
Yeah. Who proposed to who when you got married?
Well, I don't think anybody proposed to anybody. We're just looking at jeweller's shops, and I said, oh, that's a nice ring. He says, all right, come on, let's go.
Oh. Is that how it happened?
I think so. No, he had to ask my father, of course.
Of course. Neville Marion tells me that you've never cooked a meal in your life.
He can do beans on toast.
No, he can do beans on toast. What's your favourite meal that Marion cooks?
Most of them.
Oh, that's a good answer. Very diplomatic, isn't he? He knows which side his bread's buttered on, doesn't he? You wouldn't know what to do without her, would you?
Not really.
No.
Marion cooks for Neville and has done for the last 63 years.
You'd be lost.
These two are so sweet together. But what's he going to do without her if she needs to be in hospital for a few days? He's depended on her for the last 60-odd years. I don't think he would know how to live without her.
At the rodeo, Elle and Dodsey are preparing to take 68-year-old George to hospital.
George, so I understand, I heard the story, so you got knocked and you got hit in the sternum by the gate, okay, and then you were unconscious for a brief period of time.
The rodeo boss is suffering agonising chest pain after being slammed by a steel gate.
You want to come up here, Dom?
His partner Sonia has been at his side since the traumatic accident.
To see him lying in that state was really quite a shock.
George, are you allergic to any medications at all? Okay.
All my bad, negative feelings that I'd had about this sport, it was like it was all coming true. And I was quite horrified.
How are you feeling now? Where's most of your pain? Right in the sternum, okay. Are you feeling short of breath as well?
Oh, a little bit.
Okay, well, I'm going to give you some morphine for the pain. We'll get 5 of morph on board, get him off the board and get out of Dodge.
Ready, set, go.
And out.
Sorry, mate. Sorry.
There we go.
Good work, Benny.
Okay.
Sorry, old mate. Where's that
All right.
sore?
In his chest.
Righto,
Okay.
mate.
I'll see you later.
Which way?
It's pretty clear that he's got a significant injury. George may well have a collapsed lung.
Jesus Christ.
Yeah, sorry, mate. I know.
Oh, it's all right, mate. It's really busy, freaking stupid.
All right.
The wrong place.
Try and give us a big breath.
Oh.
Sorry, mate.
Sorry, buddy. Yeah, I know, mate.
A collapsed lung can be fatal. El's getting ready to intervene if he needs to relieve the pressure in George's chest.
I'm doing a little bit of work preemptively, drawing on his chest, on the possibility that I'm going to stick a needle in his chest, which is about that long.
As Sonia watches on, she's fearing the worst.
I'm a widow and I really didn't expect this at the later stages of my life, but George has made a big difference in my life. So I'm absolutely frightened because I could lose him. I could lose him.
Fuck, it hurts when you get older.
Yeah, I know. It's a bastard of a thing, isn't it?
Lovely. Have you got a little blankie?
Single responder Glennis is waiting for 6-year-old Harper to recover after the little girl was given a powerful sedative to stop a frightening seizure.
How would you like to manage this from now on, guys?
Yeah, I'm pretty happy.
Yeah, she'll sleep it off.
Harper suffers from a rare, devastating form of epilepsy. Her parents, Aaron and Kelly, have had to endure watching their daughter go through these ordeals since she was just 9 months old.
All right, love, I'm just going to take some of these dots off you.
You know, once you give her the medication, she'll sleep for hours afterwards. She's very conscious of how we feel, so sometimes she wakes up emotional, which is hard, and she often asks, are you upset with me? Or she says, I'm sorry, I had a seizure, which, yeah, is really hard to handle because obviously it's not her fault.
Oh, yes. Oh, darling. Like I'm tickling you, isn't it? But not nicely. Kelly and Aaron are amazing. They have dealt with this condition for a long period of time. You know, kids aren't... They always make us nervous. I don't know how you cope. Oh, fantastic. You work local? Yeah. Generally, we would take a child who's been given midazolam at home to hospital. See you, Frankie. But not only are Harper's parents amazing in dealing with their child's condition, but they both work for Fire Services Victoria. So Harper is actually in the best care that she can be in when she's at home.
Aaron and Kelly will call paramedics back if Harper doesn't make a full recovery.
Bye!
But that could take hours.
Frankie, have you seen Mum's lights? Yeah, theirs are a lot bigger than ours, aren't they?
Just standing, mate. Shoulders okay? Tummy okay? Pelvis?
Intensive care paramedics Dodsey and Elle are urgently delivering 68-year-old George to a major trauma centre.
How's your pain at the moment? Okay, you just told me. Just going to top you up with a little bit more morphine.
The radio boss was knocked unconscious during a bucking horse competition.
You hit the ground. Did you get yourself back up?
No, I don't go hit the ground.
Okay.
It's a 40-minute drive to the hospital. Al's still worried that his patient may have a potentially fatal collapsed lung. But George's breathing has improved enough for Al to hold off any immediate invasive treatment.
Did you use the right?
Yeah.
Oh, jeez.
We use the right balls.
Really?
Yeah.
Did you have any major falls?
Not bad once.
The person who worries most about George still being hands-on at rodeos is his partner, Sonia. She's given up trying to get her man to walk away from his lifelong passion.
I try to boss him, but there's no way known I could stand between him and his sport. It is something he loves, and it would be cruel of me to stand between that.
It's a pretty dangerous occupation. Ever thought it might be time for retirement?
No.
Righto, good call. I've been asked that too.
Yeah.
I give the same response.
Should have done it 10 years ago.
Thank you very much. Thank you very much. No, we love that support. This is Georgie. This is how we roll here.
Oh.
Yeah. Just when a man's vulnerable, bang, that's what I get.
We keep him round for his comedic value.
Oh,
That's
yeah,
not even
thanks.
funny either.
Yeah, thanks.
Al should have retired 10 years ago. He still thinks he's got 10 in him. I don't think so.
Dodsy's always got a bit of a quip, in particular with me. I don't know what it is about me and him. Yeah, it's a bit like the odd couple, isn't it, I reckon?
We've been with us for, what, 39 years?
39?
Yeah.
Dodsy's been doing this for bloody 42.
Years?
Well, 42 seconds, he said.
42 seconds. Sounds like my love life.
Oh, don't sell yourself short there, mate. I've heard it's at least a minute. Just a couple of bumps here, George. Okay, you're right?
Yeah, right.
Good man. Thank you.
George's pain is now under control, but only X-rays will tell the full story. Hopefully, his altercation with the gate won't spell the end of his illustrious rodeo career.
Thank you, kind sir.
Can you remember your wedding day?
Yes.
Back in Taz and Amanda's ambulance, lifelong love affairs are also being discussed.
It wasn't a big wedding, and I wasn't running in white. I had a suit.
Their patient, 81-year-old Marion, and husband Neville have been living in wedded bliss for nearly 63 years.
In the 50s, we still had some rationing. We had coupons, you know.
Yeah.
So it was hard to get a lot of things, but Mum did it at home, and she did a lovely job.
Beautiful.
Yeah.
In Marion and Neville's day, it was far more about the marriage than it was the wedding, you know, and look, it worked. They've been together for 63 years. You know, no elegant big gown, you know, made by Vera Wang. Very simple, and at the end of the day, the goal was just to marry the man of your dreams.
We have funny moments, of course, when he puts the wrong clothes on. I usually lay out his clothes on the bed for him to make it easy.
Gosh, she dresses you, she feeds you. You would be lost without her, wouldn't you? So 63 years, what's the trick? What's the secret?
Oh, every now and again you've got to clock him round the ear a bit. Bring him into line.
I like it.
You can tell after 63 years that they don't just love each other, they're in love, and it's beautiful.
But while it's been a sentimental journey to hospital, Amanda and Taz are still worried that Marion's severe case of cellulitis could easily turn into a life-threatening infection and keep her in hospital for several days.
Just want to make sure that she's okay.
She'll be fine after some antibiotics.
When we're taking patients like Marion to hospitals, we're not just thinking about Marion, we're thinking about the other half also. It can be very sad because Marion and Neville represent two bodies, one soul. You know, you're praying, you wishing, you hoping that she gets better so that she can be with Neville.
Patient who has fallen and is unconscious.
In Melbourne's Outer East, intensive care paramedic Cullen is on his way to a man who's unconscious after a fall at home.
Concerns of this job would be that if he remains unconscious, that he might lose control of his airway.
Reports are also coming in that the man has been drinking.
Whenever I go to a job where someone's alcohol affected, I do have heightened situational awareness because there's the potential for violence as well. There's police there. It's pussycats. Hey guys, how you going? My name's Cullen. The police in here as well?
Yes, they are.
How are you guys? Good.
He's breathing, but he's probably convulsed maybe 7.
Did you witness this, madam?
Yes.
62-year-old Shane is still unresponsive on the floor, despite wife Caroline's desperate attempts to wake him.
He fell over the coffee table, hit the heater, and down he went.
Yeah, and has he been unconscious ever since?
Yeah.
Shane, open your eyes, mate. What other medical problems does Shane have?
In
Just hit the
2007,
blood
he
pressure.
ended up with an ABI because he got walloped with a baseball bat.
Finding out that Shane has an acquired brain injury changes things dramatically. I now need to work out what is the result of the acquired brain injury, what part is due to the alcohol, and what part is due to the actual head strike tonight. So does he have seizures normally?
No, never.
Has he had a seizure tonight?
He's had 4 while
So-
we've been here.
He doesn't normally have seizures associated with his pre-existing head injury.
Shane, open your eyes, mate.
So that's obviously a sign that the head injury he sustained tonight is quite significant.
So he's a true GCS of 3. No response verbally, motor or eye openings and nail bed pressure.
Shane could have a bleed in his brain. Cullen needs to get him to hospital urgently.
Shane.
But suddenly, Shane wakes up, confused and upset.
Shane, it's all right, mate.
When people are agitated, they're probably the hardest patients for us to manage. We're suspecting that he may have a potential spinal injury as well.
Shane.
If Shane has further seizures, we may need to put him into induced coma and take over his breathing to protect his brain from further injury. So Shane's in a pretty bad way at the moment.
You know what the biggest difference between us is? He's a morning person and I'm a night owl.
It's the start of shift for Nat and Leonard, and they're discussing relationships.
I think it's good. Me and Riz are totally opposites.
Okay, and it works?
Divorced mum of 3, Nat, is about to celebrate a big milestone with her new man.
We're coming up to 1 year.
1 year.
And look, I've still got a big smile on my face. Can you believe?
12 months, that is long term. You hit that mark, it's long term.
Do you think so?
Before that, you're in a honeymoon period. After that, things are getting serious.
So the honeymoon phase is about to wear off, is that what you're saying?
What has it?
We're still in the thick of it, so I'm hoping that it lasts. Well, I am anyway. I hope he is too. I don't know, though.
I'm not going to ask how you define the honeymoon phase and what you mean by in the thick of it.
But the deep and meaningfuls are suddenly over.
We're going to a 49-year-old female.
Yep.
Pain in chest, and it says here she's had a minor heart attack on Wednesday. Certainly could be another heart attack.
Definitely. That's young, isn't it, 49, to have had a minor heart attack?
One moment, I'm having a good laugh with Nat, talking about everyday life, and the next moment, a job comes in and it's a potential heart attack. The adrenaline starts to pump because this could be a life or death situation.
Knock, knock, ambulance. My name's Leonard, I've got Nat with me. What's your name?
Eliza,
So, Eliza, do you want to tell me what's happening tonight?
I've just got tightness in my chest.
Okay.
Pain in the left side, in here and here.
Yep. And when did that start?
Probably about an hour ago.
About an hour ago. Natalie's just going to do your blood pressure and put a few stickers on, look at your heart.
Yes, I had a little mini heart attack
Okay.
a couple of days ago.
With similar pain to what you had?
Do an angiogram and put a stent. They found a blockage.
Okay. So did they put the stent in?
No.
No.
They couldn't in
Just
there.
your unlock.
So they've sent you home and...
Sent me home with medication.
Okay, okay.
Having already rushed his wife to hospital once this week, husband Hugh is terrified Eliza's life is once again in danger.
How long have you been married for?
2.5 months.
2.5 months, so this is fresh.
It's fresh.
Still in the honeymoon phase?
Yep.
Eliza looks remarkably calm, but I can tell that Hugh is really worried, and he has every right to be. I mean, the love of his life, who he's just married, is potentially having a heart attack, and she could be in real trouble.
Shane, it's all right, mate.
Cullen is also dealing with a family under stress. 62-year-old Shane has just woken up after falling over a table and cracking his head on a heater. But he's confused and agitated.
Do you think you can roll him back over to the side and get the board under him? Yeah.
Cullen's worried Shane could have a bleed in his brain and can't rule out a possible spinal injury.
We're just organising extrication. He's waking up a little bit.
But a combination of alcohol and an existing brain injury make him a tough patient to assess.
Shane, it's all right. Shane, does he normally yell out like that and not make sense like that?
He does.
He does. But when he's drunk, he behaves like this.
Sometimes, not all the time.
Yeah. Just relax for us, mate. I think there's a bit more alcohol, not necessarily all head injury.
We're in a really difficult situation with Shane.
Oh, let's get some fentanyl.
There's a lot of people in the room. The police are there, his family are there.
How many cats are in this place?
And there's lots of cats everywhere. And when a patient's agitated as a result of his head injury, not from any other reason, it sometimes can put our safety at risk. We're there to treat Shane and help him, but if I'm injured, I can't do that.
Despite a strong sedative, Shane's becoming more agitated.
Just lie still, lie still. Lie still. Lie still, mate.
People with head injuries like Shane can be difficult to manage, but I don't take it personally.
Don't spit, Shane. Shane, don't spit.
As much as I hate spitting, I know that Shane wasn't really trying to hurt me.
I think the plan, Robbie, is that we don't stimulate him too much because he's then going to try and jump up. I've just given him a dose of fentanyl, which should calm him down a little bit. All right, we're right to move.
I need to calm Shane down. I need to give him some more medication to sedate him, because if we don't do that now, things may get worse for him and for us.
Shane, lie down for us, mate. Shane.
Now, when you take a deep breath in, that doesn't change the pain in any way.
A little sharper, like a stab when you take a big deep breath in.
Yeah.
It's been just 4 days since Eliza was rushed to hospital suffering a heart attack. Now, Leonard and Nat are worried she's having another one.
Do you mind if I lift up that left breast? Okay. Yeah.
As Nat gets the ECG ready, Eliza reveals more of her disturbing medical history.
I've had brain surgery twice, heart surgery once.
Oh, goodness.
Back surgery and a left kidney removed.
Stan.
I'd like to be here, so just do what you need to.
Understood.
Where is Maddie?
Seriously, I cannot believe how many medical problems Eliza has endured at such a young age. But what we are most concerned about today is the chest pain that she's called us with. Is she having another heart attack?
The results of the ECG are causing concern.
There's just a little bit of suspicious activity on our ECG, so I'm going to watch it like a hawk and see if it changes. There are early signs that lead me to believe that her arteries are blocked in her heart, and this is a time-critical event. I worry that that's a recipe for disaster. We need to make sure that Eliza is not moving to a full-blown heart attack.
We're going to make a move. If you feel dizzy, let us know.
Sit down for us, Shane, mate. You're with the ambulance, mate. Just lie down.
Intensive care paramedics Cullen and Robbie are dealing with a far more difficult patient. 62-year-old Shane fell at home and cracked his head on a heater. He's now highly agitated and could be suffering a bleed in the brain.
Do you think he's being stimulated, or it's just bumps that are making him jump, or is it a pattern to it? Yeah. All right.
Family told Cullen that Shane's already coping with a pre-existing brain injury.
Nice and still. Shane, sit down, mate. Shane, sit down, mate. Sit down. What do you need? Sit down for us, mate. All right? Need a towel. A towel.
Shane's been difficult to understand all night. That's not a good sign.
Yeah, he's saying something about a towel, isn't he?
We're just trying to work out what he's actually saying.
Lie down for us, mate. We'll get you a towel, all right? We'll get you one.
I think he's asking for a towel.
Here we go. Here's one I prepared earlier.
So I give him a towel, hoping that will calm him down and reassure him.
Shane, you're with the ambulance, mate. It's okay. Lie down, mate. Lie down. Got a towel here for you, mate. Just lie down.
He's asking for my mum.
What's he saying?
He's asking for my mum, Caroline.
Oh, he's asking for Caroline?
Yeah.
Shane's daughter Robin sorts out the confusion.
She's on her way.
Caroline's on the way to hospital.
She all right?
Yeah, she's all right.
She's all right.
She's okay.
All the time, he was just asking for his wife.
Caroline's okay. We've got your daughter in the front.
Dad, I'm here.
All right? Everyone's okay.
And Shane seems to really respond. Once we tell him that she's okay, he calms down.
She's okay. Yeah, it's much more understandable now than I was saying. Yeah, no, I know what he's saying. Yeah. You're with Cullen and Robbie, mate, in the ambulance, and Caroline's okay. She's going to meet us at the hospital. All right? Almost had a conversation then. Yeah.
When we arrive at hospital, Shane's improved a little bit. He's settled down, he's less agitated, but we still won't know if he sustained any further brain injury until he has a CAT scan at hospital. So unfortunately, he's not in the clear just yet.
It's nice and still. That's it.
give you a pillow as well.
I know.
All the sticky beaks are going to come out now.
Nat and Leonard are preparing to transfer Eliza to cardiac specialists. The 49-year-old might be having her second heart attack in just 4 days.
Going in.
Despite the fact that Eliza looks quite well, heart attacks can be really dynamic. Patients can go from just talking, looking okay, to the next moment deteriorating suddenly to the point of cardiac arrest, and they can drop dead just like that.
Maddie's going in with Mum.
Eliza's daughter Maddie will travel to hospital with her mum. New hubby Hugh will follow by car. He's trying to put on a brave face.
All right. I'll see you there, love. See you there. See you there, darling. Love you too. See you there, honey. Come on.
She'll be
You
fine.
wanted me to get in here, so it's all right. Yeah, and you're going to hold it against me for the rest of my life. I would have stayed home.
Eliza has a bit of a dig at her husband Hugh for calling an ambulance. But hey, Eliza, Hugh has done the right thing. Anyone with chest pain could be having a heart attack. And you know what? Hugh might have just saved your life today.
No, he's done the right thing.
He has.
I know. You heard that, did you?
Yeah, he's done the right thing. Yeah, I don't say that very often. Happy days?
Happy days, good. I'm going to do another snapshot of your heart, and we're just going to keep looking at that.
For Eliza, being in the back of an ambulance is not a new experience. She's been battling chronic health issues her whole life.
I was 6 years old when I had my first heart surgery.
First heart surgery at 6 years old.
Yeah.
Things like
I
that.
had an awful accident, horse riding,
Oh,
7 years ago, and broke my neck.
Oh, really? Thing in the end?
Things
Or?
failed when I had my daughter, took her out, and then took my kid.
What she has had to go through is unbelievable, and I'm just hoping, like anything, that she's not having another heart attack.
So this has happened, and obviously your husband, who you finally married, really kind of got you through everything? He did, yeah.
He's been amazing. I've known him for 7 years, and he's stuck by me.
And isn't that amazing? Like, you marry your best friend, and really that's what you have to do, isn't it? You're a team. When you know you're loved, you have a reason to live. Yeah, it's beautiful.
The team has now arrived at the Alfred Hospital. Doctors are standing by to investigate Eliza's heart, but Nat has one last question.
Is this your second marriage?
Yes.
Yes? Do you recommend it?
Second time round, I
Yeah,
do.
you seem very
So
happily
good.
married.
I am.
Gives me hope.
It does.
Second time lucky.
Absolutely. Just wait for the right person.
Oh, I think I found him, so
That's nice.
he's hoping.
Oh, excellent.
We'll see, though.
You never know.
You never know. No. Yeah. You know when it's right, don't you?
Come around here. Good job. Good job.
It's now 2 months since 6-year-old Harper's life-threatening seizure. Suffering from a rare, devastating form of epilepsy, it's a never-ending fight.
Keep going. Keep going.
Most people think Harper's just a normal girl, and until they actually learn about her, they would have no idea. She loves to do things that every other kid loves to do. But she's very compassionate. She's always thinking about other people. She's a very loving person.
Sometimes does the ambulance come when you get sick and the paramedics look after you? Yeah. Do they do a good job? Yeah. Probably in the last year, she's a lot more aware of what's going on. Yeah. We don't keep anything from her. We talk to her about it. And Harper's the strongest, bravest, most resilient little girl I know. She just gets back up and she keeps fighting. And she doesn't complain, she just gets on with things. So I get my strength from her. People always say to me, you're so strong, and that's where I get it from. She's so strong.
I had a little mini heart attack a
Okay.
couple of days ago.
Nat and Leonard's patient Eliza has also been through a tough time. It was confirmed she did suffer a second heart attack. Doctors discovered 80% of her right coronary artery was blocked and put in a stent. Fortunately for new husband Hugh, Eliza has had no more heart problems. But the 49-year-old's bravery has left a lasting impression.
I think we can learn a lot from Eliza, that no matter what has happened, she's just remained positive throughout. It's kind of made me feel that even when I have down days, I should just kind of go, you know what?
It's not
life
that
is
bad.
good. Life is not that bad. I've still got a good family. You know, I've got a great wife and loving family, baby on the way.
And I think it reminds me that it doesn't take that much to be happy, really.
Yep, absolutely. Love and family.
So all the redness is new?
Yes.
It was love that had Marion so worried about going to hospital and leaving her husband Neville alone at home.
No. Think about you.
Doctors told the 81-year-old the cellulitis in her leg was close to turning septic and put her on an antibiotic drip. They wanted her to stay overnight, but Marion insisted on going home to look after Neville. Shane cracked his head on a heater, and Cullen was worried the 62-year-old could have a life-threatening bleed in his brain.
Shane, you're with the ambulance, mate. It's okay. Mate, it's okay.
Already suffering from an acquired brain injury, tests showed Shane had suffered no further complications from the fall.
It was a very interesting job, and I don't think I've been to a job in ambulance in my 18-year career that I've seen more cats.
Up on the couch, there was a cat. Under the TV unit, there was a whole bunch of kittens. I remember one particular job, and we said, oh, we're going to take you up and give you a CAT scan. And my partner picked up the cat that was in the room and went over the person. He goes, here's your CAT scan.
Ready, set, go. And out.
68-year-old rodeo boss George was knocked unconscious during a bucking horse competition.
Oh.
Sorry, mate.
George's partner Sonia was terrified she was losing him.
Come on.
But thrill seeker George got away with a small bleed in his brain and severe bruising to his chest. He's now completely recovered and ready to rejoin the Cowboys.
The rodeo, it is a dangerous sport. There has been a few fatalities, but if you die, you want to be doing something you love, don't you?
You'll have to call Olive, Dale. She likes you better than me.
Despite Sonia's respect for George's passion, she's put her foot down.
Well, there's one restriction, I suppose. The bosses said, you don't open gates anymore. You stay away from that. I think I did 2 gates and she spied me doing it. And I looked over and there she is standing up on the bank, hands on hips. Yeah.
I spotted him.
These mature lovebirds are grateful they've still got a future together.
Second chance are good.
Absolutely.
And somebody I'd like to share it with as well. Yeah.